Welcome back. The SA Medical Research Council says that Professor Ntobeko Ntusi will now take over as President and CEO of the institution. He takes over from Professor Glenda Grey, who's been the President of the Council for the last 10 years. Her term's coming to an end. Professor Ntusi is a cardiologist, currently the head of the medicine department at the Grooteschuur Hospital and a professor at UCT. Professor Ntusi, good afternoon to you and congratulations on your appointment.
Good afternoon, Stephen, and many thanks for your generous congratulations.
What do you believe the role of the Medical Research Council should be? What kind of focus do you think it needs to have?
So the SAMRC, in my view, arguably one of the most important science councils in the country, is really the custodian of health research in this country. Besides determining the priorities for funding for research, it plays an absolutely critical role in supporting government in bridging the gap between strategy or policy and implementation. And on the other hand, Stephen, it plays a critical role in developing the capacity for a new line of clinician scientists in the country, but also the development of evidence that informs both policy and interventions. And as a science council, it not only funds research, it conducts its own research. It plays a key role in facilitating development and innovation, but also developing capacity. And the other really key important area is providing the value proposition for science and society, which I think is particularly important in the age of disinformation and people having lost trust both in government and in science.
South Africa is a country that has got many health problems. It's also, in a strange way, because of those problems, quite an important place in which to do research, perhaps quite an interesting place in which to do research. And if you can solve some of our problems, you'll solve some of the world's problems.
I couldn't agree more. And in taking up this position at the SAMRC, I've been particularly keen to see how we consider the historical role of the SAMRC in contributing to diseases of pestilence, of poverty, and infections, to the work it does currently, a focus on the quadruple burden of disease, as well as health systems, and to start to think critically about the emerging health challenges of the future. These relate to conditions like non-communicable diseases, which are now the leading causes of mortality in this country. The use of digital health and artificial intelligence, which affects all aspects of healthcare. Thinking about planetary health, we're seeing in this country the impact of planetary changes on many aspects of our lives, but also on livelihoods and healthcare. And of course, COVID-19, I think, has been a very stark reminder of the importance of pandemic preparedness and how the SAMRC positions itself together with its partners as the key institution to help the country respond appropriately to this.
Well, Professor, I was going to ask you about that because obviously we saw the Medical Research Council really being very prominent during that time, in public at least. Do you think we've done anything as a country to prepare in case of another pandemic? I mean, I remember during the pandemic everybody used to talk to us about how important it was to prepare for this to happen again in the future. Since then I've heard very little about it. Are we making any preparations?
I think there have been a number of really important lessons, Stephen, from the COVID-19 pandemic. And as a consequence, we have been able to use our very strong foundations in HIV research, tuberculosis research, and to pivot those to respond in a very ad hoc fashion, but successfully, to many of the challenges imposed by COVID-19. But what has emerged as a learning from the responses has been a much more coherent and systematic approach and building of partnerships in thinking together about how we prepare for future pandemics. And now we have a number of institutes based at universities that are focusing precisely on this question. The SAMRC, together with other science councils like the NRF, has been really applying its mind to how it works with government to enable a much more successful but timeous and effective response to future pandemics. And my sense is that there is both huge investment but also significant political will in allowing the country to respond better to future pandemics.
One of the things we face, obviously, is the HIV pandemic, and you as the Council have recently won, I understand, a big grant from the US, from USAID, to investigate potential vaccines for HIV. I mean, that research is vitally important.
Critically important, and this is really one of the untapped frontiers in HIV medicine. So what we've seen over the last few decades has been the evolution of HIV from a deadly disease. Now with highly effective antiretroviral therapy, people who are adherent to their medication are able to live normal lives, and we've seen a significant improvement in the lifespan of South Africans in the last 2 decades. And with treatments like PrEP, we are now able to prevent infections. But one of the promises of science is the ability to use vaccines to prevent future infections. And so rather than focusing on treatment, to actually focus on prevention. There's been huge investment in vaccine studies in HIV, and there is in fact a large global network of clinical trials focusing on vaccines that my predecessor, Professor Glenda Grey, co-leads. And to date, there's been no successful vaccine for HIV. But with this grant, she and Professor Linda Gale-Beckham are pioneering a new program of studies led by these 2 women with other African scientists to build capacity for clinical trials on the African continent and to hopefully come up with a vaccine that will be the critical step in preventing future infections from HIV. As you know, Africa still carries the burden of the disease, with 69% of those infected with HIV residing in sub-Saharan Africa.
And Professor, you yourself personally, I mean, I think you're still working in a hospital at Grooteschuur. You're a professor at UCT, so you may still have students. Are you going to miss that, treating patients and teaching students in your new role?
Fortunately, I don't have to give that up, Stephen. I am planning to continue my much more strategic work at a higher level at the SAMRC. But for the SAMRC, it's critically important that their president is research active. And so I plan to retain my research group at the University of Cape Town to continue to supervise postgraduate students. But I also hope to continue to contribute clinical services to our patients here at Grooteschuur Hospital.
Thank you very much indeed. Professor Ntobeko Ntusi is the incoming President and CEO of the South African Medical Research Council. So, thank you.